Knowledge and information, key factors in reducing your risk for congestive heart failure. Dr. Michelle Albert, Chief of Cardiovascular Medicine at Howard University Hospital, is here to talk about this important health concern for thousands of African Americans. Dr. Albert, good to have you with us.
Good day. I'm pleased to be here.
Explain the difference, please, between a heart failure and congestive heart failure.
Right. So heart failure is more of a broader term that encompasses congestive heart failure. Congestive heart failure refers to fluid filling up in the lungs, which is typically a symptom of all types of heart failure. So there are two main types of heart failure. There's preserved ejection fraction heart failure, where the actual function of the heart remains normal, sort of by numbers, but it actually is in fact not normal. And then there's reduced EF heart failure, where the ejection fraction is decreased. Normal ejection fraction is between 55 to 65%. And so somebody with preserved ejection fraction heart failure has an ejection fraction that is preserved, so it's usually above 50%.
So what does all of this mean? I mean, does it mean, like for the first one you mentioned, that I would notice I had some symptoms, whereas the second one...
For both, you can have very similar symptoms. So the symptoms of heart failure include congestion, so that's why you've heard the term congestive heart failure.
So
it's shortness of breath,
okay.
So fluid building up in your lungs, feeling very tired, fluid building up in the rest of your body, your legs being swollen.
Where's all this fluid coming from?
The fluid is coming from the fact that the heart is not pumping blood forward to the rest of your body to supply adequate oxygen to the body in a normal manner.
And so what's
so the blood backs up essentially into your lungs, and that's how you become quote-unquote congested, and you develop breathing difficulty. Some individuals in severe instances may need oxygen, may need to be put on a breathing machine to help them breathe. So
one of the keys that you need to look out for, one of the key factors is if you are having difficulty breathing, go to the hospital. We don't know, it could be asthma, but it could be something more serious.
Right, and in fact, many folks are told they have asthma, and in fact they have heart failure. If you develop asthma and you're given the diagnosis of asthma and you're over age 50, it likely is heart failure.
Really?
And because most asthma is diagnosed at a much younger age, as a child or a teenager. So many older folks might be told that they have, it's just some asthma symptoms or some allergies. And in fact, you are developing heart failure. So to reiterate, the symptoms are shortness of breath, swelling in the legs, your pants might not be fitting you as normally as it might. So your pants waist might get bigger for men and for women, and you may be gaining weight. And you notice that it's not actual weight from eating food, but fluid-related weight.
So you feel bloated? Is it
you feel bloated. Sometimes you may not feel bloated, but a rapid weight gain over time, and your legs are becoming like tree trunks, essentially. And another symptom is actually a symptom of tiredness. So there's some folks who have low ejection fraction heart failure, which would be, again, an ejection fraction somewhere less than 50%, but mostly less than 40% or so. They may show up with more tiredness. Both types of heart failure, you can show up with tiredness, but tiredness and fatigue, sleepiness, feeling a little bit restless, those are all symptoms of heart failure. And I think one important thing for African Americans to know in particular is that the major risk factor for heart failure in African Americans is actually not heart attacks, as it is in the white population, but it is actually hypertension or high blood pressure.
So why does it present itself differently in African Americans versus whites?
So it's not that it presents itself differently, it's that the causal factors are similar, but the dominant causal factor in African Americans is actually high blood pressure, and that's in part, I think, because the prevalence of high blood pressure in the African American population, actually the black population worldwide, is way higher than in the white population.
Is this hereditary?
In terms of the hypertension?
Yes.
So, I mean, I think the jury's still out on that. I think it's a combination probably of genetics, diet, and environment, and socioeconomic status, multiple factors. There's been at least 50 years of research going on about hypertension, and we still don't have a key reason why blacks have more hypertension than whites do.
Is the research looking at African Americans? Because a lot of the research just looks at whites, and we don't have research on how African Americans fare.
So increasingly, research is looking at African Americans, and we have a program actually that I am a part of, which is called the Get With the Guidelines program by the American Heart Association, that collects data on heart failure, heart attacks, and across all race and ethnic groups in the United States. And that's a database. So it's not a clinical trial, it's just collecting real life data. And that work coming out of that database suggests a few things. The first is that the disparities that we note in heart failure between blacks and whites in terms of therapy are improving over time. In fact, one of the key treatments for heart failure in blacks, especially blacks with symptomatic heart failure, is something called nitrites. Isosorbide dinitrate and hydralazine. And those two drugs are known to decrease lives and decrease hospitalizations in heart failure. And actually many African Americans don't actually get that therapy to the level that they should get that therapy. However, on the flip side, devices that are used, the defibrillator devices that are used in patients with reduced EF heart failure because they're at risk for having sudden cardiac death, because they're at risk for cardiac arrhythmias, the electrical problems that happen with heart that just can happen in somebody with reduced EF heart failure. Blacks are increasingly getting those. In the past, we knew about a decade ago, blacks were less likely to get a defibrillator. Now blacks are getting defibrillators more frequently than they did in the past.
But if not enough research is done on congestive heart failure in African Americans, then how do we know that the current efficacy for treating the disease with respect to African Americans, how do we know that that's the right treatment?
I would like to rephrase your question slightly and say that the risk factors for heart failure in both whites and blacks are generally similar. There are certain risk factors, such as hypertension, that is more common, and it's a more common precursor to heart failure in blacks. I think that there needs certainly to be a lot more research on heart failure, the trajectory of heart failure in African Americans, how early African Americans may be susceptible to heart failure, what therapies may be preventive therapies for heart failure in that population. However, I do believe that once folks get the diagnosis of heart failure and they're in the what we call stage C or stage D or stage 3 or stage 4, there are different stages, classifications for heart failure. Typically, the therapies in-hospital therapies for acute heart failure can be similar. The problem occurs when they leave the hospital. And I think that's true across the cardiovascular domain, where there's problems with adherence to therapy. There are insurance issues that prevent getting the adequate access to care. And
well, hopefully the Affordable Care Act has taken care of that.
Well, we will see.
Yes, we will see.
and so I think in general there still needs to be more work done. However, we know that the therapies that actually do help and that do reduce morbidity. I think two other points is that heart failure is the #1 sort of epidemic in cardiovascular disease in this country. There are more than 5 million people with heart failure, and it's cropping up to 6 million people. And also, if you get a diagnosis of heart failure and you're hospitalized today, 50% of people who get hospitalized today with heart failure would not be alive in five years, related to the heart failure diagnosis. And I think that's really important for folks to know. How do you prevent it?
Yes.
It's the usual cardiovascular risk factor prevention. For African Americans, I mentioned, making sure you control your blood pressure, know your numbers. Your systolic blood pressure should be less than 120. Your diastolic blood pressure should be less than 85. Controlling your cholesterol levels, knowing the entire lipid profile, not just knowing the total cholesterol. Maintaining a healthy weight, and physical activity is extremely important. And I think those are some of the upstream issues.
Dr. Michelle Albert, thank you so much with Howard University Hospital. We appreciate you informing us about congestive heart failure.
Thank you very much for inviting me in.